right. Well, thank you so much for the wonderful introduction. Very grateful for the chance to speak with everyone today. Being July, I just want to say I hope everyone had a wonderful 4th of July holiday, got some rest and relaxation with their families, and I'm going to go take it away. So, the overview for my talk is going to be a little bit about sickle cell disease, or a lot, in fact, and the biopsychosocial model. And, in general, sickle cell disease is an overview. It's a lifelong condition that affects the shape of red blood cells and how they move throughout the body. One of the most difficult parts of this illness is the pain. Patients living with sickle cell disease may experience sudden, severe episodes of pain, which we often call pain crises, as well as daily, long lasting pain that can affect and impact their entire lives. In this talk, we'll take a closer look at the different types of pain that sickle cell patients face, why the pain happens, and what we've learned about how to manage it. We'll discuss both medical treatments, such as pain medications and other supportive therapies, as well as non medication approaches that focus on mental health and emotional health, and hopefully everything in between. We'll also highlight how pain care works best when it's part of a team approach, where doctors, nurses, psychologists, physical therapists, and patients themselves all work together to find the best possible plan. Our goal is not just to reduce pain, but to improve quality of life and help people live well with this condition. So, with that said, what is sickle cell disease? So, sickle cell disease is a group of inherited red blood cell disorders that impact the hemoglobin that's inside the red blood cells. Hemoglobin is a protein that carries oxygen throughout the body, so it's very necessary. And normal red blood cells are disc shaped and flexible to easily move through the blood vessels, as you can see in the image that we have above. And we also have some sickle cells in this image. And in sickle cell disease, the red blood cells become crescent shaped or sickle shaped. And that's due to a genetic mutation. So these sickled red blood cells, they don't bend or move that easily, and they can block the blood flow to the rest of the body, which is where a lot of the disease symptoms come from. One way that I've always thought of this, and especially given that it's July and summer, the red blood cells that are circular, I kind of think of them a little bit like inner tubes that you may see on the beach or in the pool. And they're flexible, they're bendy, they do a good job transporting through the blood vessels. Sickle cells are a lot more rigid. You might want to think of them like a canoe or a kayak, where they may be able to go through a straightaway, but if there's twists and turns, they may get stuck in the blood vessels. And when they're stiff and they're sticky and they get stuck, unfortunately, bad things can happen. And this is just another bit of an animation or photo that just shows going to the left on your screen, just what it would look like, just regular circular blood cells going through, carrying oxygen to parts of the body in need. And to the right would be a combination of regular blood cells or blood cells that have started to sickle and get that crescent shape. And you can see them piling up a little bit, where in this rendition or photo, they're just impacting good flow. And that's something that we don't want to see, because when that happens, as you'll learn in a little bit, there's a cascade of other effects that can really impact the way a patient feels. Who's affected by sickle cell disease? And sickle cell disease affects more than 100,000 people in the United States, 20 million worldwide. We've got a map that shows a little bit of a heat map showing which states it's most prevalent in and where you're more likely to run into a patient population. In the United States, most people who have sickle cell disease are of African ancestry or identify themselves as Black. 1 in 13 African American babies are born with sickle cell trait, meaning they're a carrier, which I'll come and explain in a little bit. And 1 in every 365 babies are born with sickle cell disease, or actually the phenotype. And you can see that some states, such as California or Louisiana, where I did my training, or Florida, Texas, or Illinois, have a much higher prevalence of disease than other states. So I think it's important, especially As everyone here that's on this talk, they're either a provider or they're a patient or they have friends or family members that may have a sickle cell trait or disease, or they may be here just as part of the general pain series talk because they know someone with a form of chronic or acute pain. And I think it's very important just to note that even though we're going to be talking about sickle cell disease, a lot of the techniques and treatments are applicable to a wide range of acute or chronic pain, diseases, or disorders. So hopefully this talk will give something for everyone and provide some good information and help to those that may be in need, and also understanding to the general public and communities about what to look for to help those in need. So I'm going to talk a little bit about sickle cell disease genetics. So as I mentioned before, sickle cell disease, it's a genetic disease that's inherited. That means it's passed down from parents. Um, if parents are asymptomatic or not having the disease, if they're just a carrier, then both parents would have to have the disease, or sorry, it would have to be a carrier to pass on the disease to a child. But as the diagram shows to the right side of my screen, just because both parents are a carrier doesn't mean that every child would necessarily end up having the disease. A child may end up not having it and having normal hemoglobin. They may be a carrier, or they may have the disease itself. So we all get one gene from each parent. If both parents carry the sickle cell gene, that means there's a 1 in 4 chance their child will have sickle cell disease. There's a 1 in 2 chance that the child will be a carrier or sickle cell trait. Um, and usually, if you have sickle cell trait or can be considered a carrier, whether known or unknown, usually there's no symptoms. But it's very important to know before having children so you can be aware to make sure that if you may be a carrier, that you can get tested, or if you're already aware and tested, you can have your partner tested. And that's just something just important to know before having children so that you can be on the lookout for this. So I mentioned a little bit in the previous slide, sickle cell trait versus disease. And it's important to know the difference. So the trait typically has no health consequences or symptoms. Many patients or individuals may not even know that they're a carrier of the trait, just since the implications wouldn't necessarily be there unless they were having a child with someone who was also a carrier of the trait. Sickle cell disease, that's if you have 2 copies of that gene, that's considered the disease that can significantly impact a person's health and cause many other symptoms. And again, this is just another diagram just showing that if 2 people are carriers, that you could have a child with no trait at all, children inherited that have the trait or are carriers, or a child with a disease. So symptoms are something to note in sickle cell disease, and it can be very widespread what the symptoms are. And as I'll show in another slide, the symptoms can really be head to toe. So sickle cell disease, very often there can be anemia or a low red blood cell count, which can cause extreme tiredness, shortness of breath, or an irregular heartbeat. Uh, there can be jaundice present. That would be a yellowing of the skin or the whites of the eyes. Often there can be painful swelling of the hands and feet, fingers and toes or joints. The pain crises that we'll talk about in a little bit in depth, those can be considered periodic episodes of extreme pain, and those can occur anywhere in the body, really head to toe, but most often in the chest, the arms, and the legs. And things to look out for again are fatigue, swelling of the hands and feet, anemia, possibly delayed growth, poor vision due to retinal damage, pain of varying intensity in the joints, frequent infections. So, how do we diagnose sickle cell disease? Since I've talked a little bit previously about having the disease or being a carrier of the trait. So, typically, we can do that with a blood test. It can be done in prenatal screening as early as 8 to 10 weeks into a pregnancy. We look for the sickle cell gene rather than the abnormal hemoglobin itself. So, As I said, it's a blood test. So for a newborn screening, they can do a blood draw screening test. The blood is tested in the lab looking for that sickle cell gene. Um, and we often do a quick and simple screen initially, and then we may do a second confirmation test just to confirm the first screen to make sure that we have everything in order. So, understanding the pain in sickle cell disease, this is just another image, and it really, a lot of it comes from that blocked blood flow through the body that can lead to serious problems, including the pain crises. And you can see that blood flow with the red blood cells, and you can see that sometimes there can be blockages in some of the vessels. And when that happens, then you have less blood flow going to a part of the body, and that reduces oxygen flow. It can lead to infection. It leads to a lot of pain, and it can occur very intermittently, or areas of the body that can be a little different every time. And you can see how those sickled cells can kind of pile up and tangle up and really just create these blockages that can give rise to a crisis. Whereas the regular normal red blood cells are flexible and would flow smoothly through the vessels in the body. So, as I said, the blocked blood flow can go head to toe and cause issues. So it can literally be in the head. There can be issues in the brain, eyes, heart, lungs, liver, in the bones, causing a vascular necrosis, kidneys. There can be leg ulcers, skin ulcers. And in the diagram to the right, I have a little more technical terms, just talking about just acute brain injuries, which could be a ischemic or hemorrhagic stroke. There could be acute hepatic or liver injuries. There can be kidney injuries, renal sickling, papillary necrosis. There can be skin ulcers or infections that are always very concerning. The vaso-occlusive crises that can cause bone marrow necrosis or osteomyelitis, the acute splenic injuries, and acute chest syndromes, which can be pneumonia, or even things such as right ventricular failure. So it's really a head-to-toe disease that can cause a lot of impact all over the body. And I think it's important to understand that because just understanding how patients, which you may know in the community, can be impacted, having that understanding can be very helpful in having empathy to help them as they go through this journey. So chronic pain and sickle cell disease, as I mentioned, that lack of blood flow, the occlusions can cause a lot of chronic pain, and there can be a repeated acute nociceptive pain from those vaso-occlusive crises or bone pain. There can also be inflammatory pain. There can also be neuropathic pain, numbness, tingling types of pains. And there can also be opioid-induced hyperalgesia, which can often be seen from patients uh, taking those opioid medications and taking a lot of them, which kind of can reset what their barometer for pain, so to speak, is. So there's a lot of types of pain that patients can experience. And that's why I think it's so important with this lecture being applicable to other types of chronic pain syndromes, because we'll be talking a little bit about all those types of pain. So, why does pain get worse over time in sickle cell disease? And a lot of it goes to central sensitization. So, the nervous system can become overactive. So, basically, after many pain episodes, the brain and the nerves, they may stay in kind of a high alert mode. So, they're just overactive, and little things can really set them off. Pain signals become stronger even without injury. So the body can start to treat a gentle touch or even minor pressure as painful. And that process where things that shouldn't be that painful become a lot more painful is really the central sensitization. So it's just like turning up the volume on all the pain signals inside the brain and the spinal cord. And, again, this is very real, very common, and many people with sickle cell disease experience these kinds of amplified pain. And as I said before, and this is just a little more technical of the previous slide, the process involves pain receptors becoming hypersensitive to painful and non-painful stimuli. There's an impairment of the inhibitory descending control and inhibitory interneurons, and they're shifting the balance toward a hyperexcitable state in chronic pain. And when this process happens, it can really cause a lot of other things to be going on. So with this pain, there can be depression and anxiety, there can be pain catastrophizing, uh, post-traumatic stress disorder, and even things such as substance use disorder that can occur because a lot of patients are taking high doses of opioids or other medications. So this is a little bit about what's going on behind the scenes that can make this so challenging for patients to work with and for providers to be able to treat. So how do we optimize the management of chronic pain? And that's with a team. So I think it's really important for anyone with sickle cell disease or any other chronic pain syndrome to get the largest support team possible. And that's really what's important here. So you want to have an expert team for sickle cell disease in this case, in hematology, but it could be a different type of a team depending on what type of a chronic pain syndrome you have. It's always helpful to have a care coordinator or somebody that can help with case management if needed, depending how severe things can be. Mental health services, another critical piece of the puzzle. One thing that can be very helpful, there's a lot of community-based organizations. It could be a group that you go to in person. It could be as simple as going on Facebook, joining a group, going on Reddit, being anonymous, but just knowing that there's other people out there that have a similar issue and that you're heard. Emergency medicine, that's also very important, knowing where to go if there's a crisis, what to do if there's an emergency. Having a pain specialist, pain doctor that can help to deal with management that you're able to meet with regularly, that you've got a good relationship with. We can never, overstate the importance of physical therapy, strengthening your body, trying to be active as much as possible. You want to make sure you've got your primary health care team and provider, and they can really act as a quarterback, so to speak, for a lot of these other services and teams, since they may be able to meet with you more commonly and they may know you a little better. Rheumatology teams, sleep specialists. Sleep is another thing that can, not be understated. If you're not sleeping well, it's really challenging to be able to, get up and about and live your life, do your thing. I know I mentioned again social support and services and community resources and support, because depending how this could impact your ability to work, take care of yourself, there's always resources out there. And with this said, I think whether it's sickle cell or another chronic pain syndrome, just know that there's a lot of services and support networks out there. The tough thing is just knowing where to go. And I always recommend asking your providers and your care team if you need something, because they may know something or a tool or a resource that you may not have thought of. And sometimes new resources come out, and we just want to make sure that all of our patients just have the biggest team possible and access to the largest number of resources possible. So I'm going to talk a little bit about an integrative model for managing the chronic pain in sickle cell disease, which also applies to a lot of other chronic pain syndromes. So acute pain, and in this case, we're looking at those vaso-occlusive crises. So there can be peripheral sensitization, ischemia, hypoxia, inflammation. And what we can do as pain doctors and providers to help with that is we can look at, from a medication perspective, over-the-counter medications, Tylenol, NSAIDs such as ibuprofen or Motrin temporarily, opioid medications if needed. And I think that's just important to note as kind of medication management for those acute crises to get someone through them. Very often, patients may have a plan where they know they're going to go to an urgent care or to an ED as needed, and they'll put those together with the providers, hopefully in advance. The neuropathic pain, the hyperalgesia, the allodynia, I think it's very important to note how critical that can be. It's often underdiagnosed and undertreated. There's medications, gabapentinoids, gabapentin, Lyrica, there's TCAs, there's topicals such as lidocaine. And, as I said, gabapentin or triptyline for TCA or those topical analgesics. And just knowing that those are available for that neuropathic pain, I think can be very important. For the chronic pain component, I know I was talking a little bit a few slides prior about the central sensitization syndrome. And considering neuromodulators, um, chronic pain can also be some of the symptoms, those chronic lesions. There can be cutaneous ulcers that can be very painful, avascular necrosis of the bone, not getting proper blood flow, or organ infarctions, organs not getting proper blood flow. So for chronic pain, some similar things, just as we discussed, medication management, long-term opioids, NMDA antagonists. So those medications from the acute pain crises for neuropathic pain, so gabapentins, nortriptyline, Cymbalta. There's also things such as neuromodulation, TENS units. Many of those can be over the counter that you can get if needed. Physical therapy, I think very important again to just be active, to be fit, to be out there and moving. And also mental health therapies. There's a lot of resources out there that patients have access to, and we just want to make sure they take advantage of them. And then there's biopsychosocial, and that's really looking at things that can be very large components or possibly worsen the disease process. Depression, anxiety, sleep disturbances, as mentioned before, sleep can be very important. Being able to attend school or a job, which if you're not able to do that, that can kind of create a negative feedback loop or cycle where you're even more depressed, more anxious. Social exclusion, not being able to go out with your friends and missing events. And looking at those cognitive behavioral techniques that can help. And we'll talk a little bit about the biopsychosocial model for treating chronic pain and how it particularly can be helpful with sickle cell disease and crises. So the biopsychosocial model, and I really kind of like this graph where it kind of, or this diagram where it really looks at the overlap from what we can do from a biological perspective, from a social perspective, from a psychological perspective, and what can we combine to get the best result for patients? And what can we do to help them to get where they need to be and have a full understanding of the process and resources and everything along those lines? So the biopsychosocial model for treating chronic pain in sickle cell disease, a couple of things to start with. First, patient education, really critical. That's why it's great that everyone is on here for this talk, because again, whether you've got sickle cell disease and other chronic pain syndrome, or just know somebody, which as you know, with chronic pain, we all know somebody that has chronic pain. So being educated can really help a lot of others or give suggestions when they're in need. So first, hydration, drinking lots of fluid. As you can imagine with sickle cell, if you're dehydrated, it can cause those vaso-occlusive crises to happen more often. So drinking lots of liquids and also helps with a lot of other pain syndromes. Getting that adequate sleep, as I keep mentioning, anything to optimize sleep. Avoiding triggers, extreme weather and temperatures, a lot of heat. I know we're in the summer. There's a lot of microclimates in the Bay and greater California area. So you want to be very cautious and plan in advance. Managing stress, it's always very important. And then taking prescribed medications and, being on top of medication management because you really don't want to just be taking medicine when there's a crisis. You want to be optimizing in advance and having your plans in advance so that we can do more for you. So I always like preventive medicine and being on top of things. So I want to talk a little bit about the cognitive behavioral therapy. And a lot of it can be focusing on ways of rethinking pain and rethinking automatic and negative thoughts, monitoring your thoughts and feelings, challenging and reframing unhelpful thoughts, and diverting attention, looking at ways to distract from perseveration, and imagery and even things like hypnosis. So different types of pathways that we can use to help to modify our response to the pain. And the good thing to know is that there's a lot of options out there, and it's just finding what works for you or your friends or your family and the best way to help them. So I think it's just always important to know that there's options and there's techniques and things are always evolving. And I think that's just something that's just very important and just very critical. So cognitive behavioral therapy and mindfulness. So I think it's important to note that we can combine the cognitive behavioral therapy with mindfulness-based techniques, and studies have shown significant and positive results for those with chronic pain. So typically, the mindfulness and cognitive behavioral therapy can involve various types of meditation, breathing exercises, body exercises, stretching combined with concentration and reflection. And it's really about focusing on the present moment without worrying about what'll happen in the future or what's happened in the past. So living in the present, focusing positively, and I think it's just important to know that these are some options that patients can look into. So for mindfulness and chronic pain, I also wanted to talk a little bit about individual mindfulness meditation. And that's something that patients can do that can involve sitting alone in a quiet, comfortable space, typically with your eyes closed or with your eyes relaxed, and not focusing on anything specific. This time of quiet calm is about connecting with yourself, calming your nervous system, and really focusing on the moment. Guided meditation, that can be a little more structured. It can involve listening to someone on a recording or in person, and they'll help you to relax into a meditative state and then guide you through that meditation. So it's focusing on relaxing each part of the body sometimes, one at a time, to take tension away. You can think of each muscle, and this is often called a body scan. And body scans can help you to be more aware of muscles, how tense they feel, so you're able to relax, to try to manage the pain, and to take proactive steps. And guided meditations often can focus on breathing techniques, learning to focus on your breathing and slow it, and often while observing thoughts with curiosity and without judgment. So, as far as mindfulness and chronic pain, there's a lot of free courses. So, there's free courses that you can look for the mindfulness based stress reduction, as we've got here. There's helpful meditation apps. Headspace has guided meditations that can help with stress, sleep, and pain. There's Calm for relaxation, sleep stories for body scans. There's something called Insight Timer. It's a free app with thousands of guided meditations. Aura has short, personalized sessions for stress relief, 10% happier. So the big thing to know is there's a lot of different apps and a lot of different tools. So you can go out there, look and see what's best for you, what works for you. And beyond the apps, I think it's important to have some books and to look into reading them in advance or to having them available for an emergency, just as something to look at. So a couple that I've looked into that have been recommended by some of my colleagues: The Mindful Path to Self-Compassion, Full Catastrophe Living, Radical Acceptance, and The Body Keeps Score. So just know, again, there's a lot of tools out there. There's a lot of books out there. And those are things that I think are important to look into in advance and to have those tools ready in advance before a crisis. And to always ask your provider team, your big support team, what they recommend. So we just want you to have the largest toolkit possible. So some additional resources. Uh, of course, there's pain psychology classes. So please ask your Stanford pain management provider for a referral. So CBT for chronic pain coping skills group. There's a pain and purpose group, all about sleep and pain group, back in action group. For education and support, we've got the Stanford Pain Science Lecture Series to again plug that, which we regularly have monthly. And one thing I think that's important, you can sign up for the mailing list, or even just search. Since if you, We've got lots of lectures from past months, from past years. We've got the recordings from Stanford Pain Medicine. So I think it's very important to know that there's a lot of tools that are out there. There's a Bay Area chronic pain and migraine support group. You can send them an email, and the facilitators there, they're going to help. Um, and again, I think it's just important to know that there are resources. So even though you may feel alone, you're never alone. Everybody works on these things together as part of a community. And everyone being here for this talk or listening to this talk after the fact, it's really important that we've got that awareness and that empathy and understanding. And one thing that you can do to also actively take control of the situation is to engage in pain research at Stanford. And there's always new studies that and we're always doing something new and innovative and currently enrolling participants for something. So I think it's important just to know that, your provider team, we're always looking to the future and what we can do to help. So again, I'm very grateful for everyone for taking the time to join in to be on for this lecture. And, you know, I think it's very important again that we're all here as a community and we're all trying to learn from each other and help and support each other. So that said, I'll turn it back over to the moderators for some questions. And thank you again so much for taking the time today.